We usually think of sex for two main reasons. One is to have children, and the other is for pleasure. In this video, I'm going to share 10 ways you can increase pleasure. I'm Rena, a urologist and pelvic surgeon. If you're new to this channel, I post fresh content every day covering bladder health, sexual health, and many other important topics. If you enjoy this kind of information, be sure to subscribe and share this channel with your friends. So let's start with number 1, communication. It sounds very simple, but you might be surprised how many of my patients come into the office and talk about their concerns. When I ask them, "How does your partner feel about this?" many of them say, "Honestly, I've never really asked." Often they just want to make sure they are pleasing their partner in the right way. I'll ask them whether their partner enjoys penetrative intimacy or if they prefer other kinds of stimulation. And sometimes they simply don't know the answer. And that's not really your fault. Most of us were never taught how to talk openly about sex. It isn't something you typically learn in sex education classes, and it's rarely a topic parents discuss in detail. So the question becomes, how do you even begin that conversation? Let me share a few helpful tips. First, try to have these discussions outside the bedroom. You don't want to bring up a serious conversation right before or right after being intimate with your partner. Doing so could interrupt the moment entirely, or it might make someone feel uncomfortable or insecure. For example, if you mention wanting to try something new, your partner might misunderstand and think, "Is something wrong with me? Am I not satisfying you?" That's why it's better to talk in a neutral setting, perhaps during breakfast, lunch, or while taking a walk together. In a relaxed environment, the conversation can stay calm, natural, and open. The second thing to remember is that this will likely require more than one conversation. It's unrealistic to think everything will be resolved in a single discussion, especially if you've never talked about it before. At first, it may feel a little awkward. You might say something like, "I'd really like us to make this a normal part of our relationship, talking about intimacy, about sex, and about how we can make things more enjoyable for both of us. Maybe we can start today and continue the conversation later." The third tip is to focus the conversation on your own feelings and preferences. For example, you might say, "I would really enjoy it if we tried more of this. How do you feel about that?" This approach keeps the conversation positive and constructive. What you want to avoid is saying something like, "I don't like it because you never do this for me." Statements like that can easily make the other person feel criticized or inadequate, as if they're being blamed or attacked. Finally, if the concern involves a medical issue, for example, trouble with erections, difficulty becoming aroused, or pain during intimacy, and you've already tried different approaches without success, it's important to seek professional help. That might mean speaking with a therapist or counselor who specializes in relationships or sexual health. They can help you work through communication challenges or identify possible emotional factors. In other cases, seeing a specialist such as Rena or another urologist can be helpful. There are many treatment options available today that can address these issues. Taking that step can feel intimidating, but this is exactly what healthcare professionals are trained to help with. Our goal is to make you comfortable and give you the support you need so you can enjoy the healthiest and most fulfilling intimate life possible. Now let's move on to number 2, being open to experimentation. What does that really mean? One aspect is being open to masturbation, both individually and within a relationship. Masturbation can actually be a healthy way to explore your own body and discover what feels good and what doesn't. Rather than seeing it as a threat, thinking, "If my partner finds pleasure alone, maybe I'll be replaced," it's better to view it as a learning opportunity. Your partner is discovering what brings them pleasure, and they can share that knowledge with you. In relationships where partners have different levels of desire, where one person wants intimacy more often than the other, masturbation can also help balance those differences, so both people can feel satisfied at different times. Another way to experiment is by exploring each other's bodies and discovering different areas that can create arousal. These are often called erogenous zones, and they can vary widely from one person to another. For some people, the nipples might be very sensitive. For others, it could be the ears, the toes, or even the inside of the elbow. Learning which areas respond to touch can make intimacy more exciting and make foreplay more enjoyable. By focusing on these zones, you add variety and deepen the experience. Interestingly, the brain connects many of these areas to regions associated with the genitals. That's why something that seems unrelated, like gently touching an earlobe, can still create pleasure. Trying new approaches can open the door to a completely different experience of intimacy. Some people even suggest a playful exercise, mapping the body. Using a washable marker, you can mark areas where you think you might enjoy being touched, and mark other areas where you'd prefer not to be touched. This can be done in a fun way, perhaps drawing circles for areas you enjoy, X's for areas that are off limits, or even using a system like green light, red light, and yellow light. Green means yes, red means no, and yellow means maybe, I'm open to experimenting. This simple activity can help partners understand each other better and create a more comfortable and enjoyable experience together. But if you're unsure, that's perfectly okay. As you begin trying new things together, keep the communication going throughout the experience. Just because you're being intimate doesn't mean the conversation stops. In fact, it should continue the entire time. Let your partner know what feels good and what doesn't. Saying things like, "Yes, I like that," or "That's not quite right for me," can be very helpful. And remember, this isn't something to take personally. You're simply experimenting and learning together. Before I move on to more ideas you can try with your partner, I want to talk specifically about women and men and how you can increase pleasure for each individually. Let's start with women. If you've watched any of my previous videos, you've probably heard me say this many times. The first thing to focus on is stimulating the clitoris. The reason is that about 80 to 90% of women need clitoral stimulation in order to reach climax, whether that stimulation happens along with penetration or separately. This is because the clitoris is the homologue of the penis. In simple terms, both structures develop from the same tissue during early fetal development. As a fetus grows, certain genetic signals determine whether the body forms male or female anatomy. If the signals correspond to XY chromosomes, a penis develops. If the signals correspond to XX chromosomes, a clitoris develops. In many ways, they are quite similar. The main difference is that the clitoris extends mostly internally rather than outward, and inside the body, it branches into two structures that resemble a wishbone. Because of this internal structure, much of the pleasure women experience during intimacy often comes from clitoral stimulation, whether it's from inside the vagina or from external touch. That's why it's important to experiment and learn what your partner enjoys most. For many women, pleasure may involve more than just penetration. This brings me to the next important point: increase foreplay. This is helpful for both men and women, but it's especially important for women. In many cases, it can take 20 to 30 minutes for a woman to become fully aroused. So what exactly does that mean? As arousal builds, the body begins producing natural vaginal lubrication. It takes time for the body's signals to activate and start that process. During arousal, the vagina also widens and lengthens, preparing the body for penetration. I mentioned this in a recent video as well. If intimacy moves too quickly before full arousal occurs, deep penetration can actually become uncomfortable or painful. That's one reason why foreplay plays such a crucial role in creating a comfortable and enjoyable experience. Now let's take a moment to talk about lubrication. One important thing to understand is that a woman's natural lubrication does not always reflect how turned on she feels. There are many situations where lubrication may be lower, even when desire is present. For example, certain stages of life can affect it. During menopause, hormonal changes occur in the body, particularly a decrease in estrogen. These changes can make natural lubrication less consistent. Some women may also naturally produce less lubrication simply because of individual differences in their bodies. During menopause, the tissues inside the vagina can become thinner and may produce less natural lubrication. This change is a normal part of the menopausal transition. The good news is that there are treatments available to help with this thinning, such as vaginal estrogen therapy. For women watching who may be going through menopause, it's a good idea to talk with your doctor about hormone options, especially vaginal estrogen. This treatment can help strengthen the vaginal tissues and often makes intimacy more comfortable and enjoyable. There are other situations where lubrication may decrease as well. For example, after having a baby, after certain surgeries that affect hormone levels, or when taking specific medications, the body may naturally produce less lubricant. These changes are simply part of how the body works. They do not mean that someone isn't interested, excited, or ready for intimacy. Which leads to the next important point: use lubrication. Lubricant can make a big difference. It's simple, affordable, and easy to find. In fact, I've created an entire video about lubricants. The main idea is that lubricants help reduce friction, making intimacy smoother, more comfortable, and often more enjoyable. There's absolutely nothing wrong with using them. People of any age can benefit from them, and they can add a lot to the experience. But to give you a quick overview, there are 3 main types of lubricants. The first and most common type is water-based lubricants. These are widely available and easy to purchase at most drugstores without a prescription. They are usually very affordable and simple to use. The one thing to keep in mind is that they tend to dry out fairly quickly, which means you may need to apply more during intimacy to keep things comfortable. The second type is silicone-based lubricants. These are usually more slippery and tend to last much longer than water-based products, so you typically only need to apply them once. Many people enjoy using them for that reason. However, you should be cautious when using silicone lubricants with silicone sex toys, because they can sometimes damage or break down the material of the toy. The third category is oil-based lubricants. These also last longer than water-based options, but they require a bit of care when used with condoms. Oil-based lubricants can weaken certain types of condoms and increase the risk of breakage. For that reason, it's generally best to avoid oil-based lubricants if you're relying on condoms for protection. Now let's talk about men. Once again, communication plays an important role in understanding what a partner enjoys and what they may not enjoy. Just like women, every man is different, and preferences can vary widely. One thing that's important to recognize is that many men feel a significant amount of pressure to perform during intimacy. They may feel they need to get and maintain an erection and last a certain amount of time. But the human body doesn't work like a machine. There will naturally be times when a man might lose an erection sooner than expected, or reach ejaculation earlier than he planned. When that happens, it doesn't necessarily mean that anything is wrong. Many different factors can play a role. Stress, fatigue, alcohol, medications, or certain medical conditions can all influence performance. When you look at the bigger picture, these situations are rarely about the partner themselves. Often, it's connected to something else entirely. So if you're in the middle of an intimate moment and still feel close to each other, it's perfectly fine to continue in other ways. There are many different ways partners can give each other pleasure, even if an erection isn't present at that moment. It's helpful to remember that we all have 10 fingers, a mouth, and even tools or toys that can be used to create pleasure and intimacy. These options can allow you to continue enjoying each other, regardless of whether an erection is happening right then. Earlier, I mentioned stress, and that leads to the next important tip: increase relaxation. When the body is under stress, it releases a hormone called cortisol and activates the sympathetic nervous system, which triggers the body's fight or flight response. In this state, your body prepares itself to deal with danger. Blood flow shifts toward the arms and legs, so your muscles have the energy they need to run or respond to the threat. The challenge is that your body can't always tell the difference between a real physical danger, like a wild animal chasing you, and everyday stress, such as a difficult day at work. The physical response is often the same. Because of that, blood flow may not go to the genitals as easily, which makes arousal more difficult. One way to increase pleasure is by creating moments of relaxation together before intimacy. Couples can try activities that help the body unwind. For example, you might give each other a gentle massage or even schedule a massage together. Some couples enjoy doing yoga together or spending a few minutes in meditation. These kinds of activities help signal to your body that you're safe and relaxed. When the body feels calm, it becomes much easier to become aroused and enjoy intimacy. If you're curious about quick ways to reduce stress, I also created a video showing how you can relax in as little as 6 seconds a day. It includes simple techniques that I personally use regularly to keep stress levels under control. The next tip might surprise some people. Schedule time for intimacy. When many people hear that idea, their first reaction is often, "Wait a minute, I don't want to schedule sex. It should just happen naturally." And that sounds nice in theory. We imagine that we'll simply feel excited about each other and intimacy will happen spontaneously. But real life often looks different. Many of us have busy schedules, demanding jobs, children, and many responsibilities. It's not the same as when we were younger, and perhaps our main focus was school. At that time, there was often more free time and plenty of hormones, making it easy to feel excited and attracted whenever you saw your partner. However, when you've been in a long-term relationship or when life brings additional pressures, it can be harder to become aroused just by seeing your partner. Because of that, spontaneous intimacy may happen less often. Part of the reason is that there are actually two types of desire. One is spontaneous desire, which is exactly what I described earlier. When you see your partner and immediately feel aroused or excited. You feel excited and want to have sex. That's spontaneous desire. But there is also something called responsive desire. With responsive desire, you may not immediately feel aroused just by seeing or thinking about your partner. However, once you're together, holding each other, touching, or simply lying close, you may suddenly remember, "Oh yes, my body enjoys this. I do want intimacy with this person." This type of desire often requires time and connection. It means being present with each other rather than sitting in bed scrolling through your phones or typing on separate laptops. It means truly sharing that moment together. And that's exactly where scheduling time can be helpful. We live in a culture where almost everything is scheduled. If you look at your calendar, you probably see work meetings, your children's activities, and even planned exercise times. But many couples never actually schedule time with their partner for closeness. Some people schedule date nights, but think about what often happens on those evenings. You might go out, eat a large meal, and afterward your body focuses on digestion. You may feel full, bloated, or tired, which isn't always the best setup for intimacy. Instead, consider scheduling time specifically for closeness and connection. During that time, turn off your phones and other devices, spend time together, and focus on being present with one another. It doesn't mean you must have sex, but it leaves the door open if you both feel like it. Think back to when you were younger. If you had a date planned for Friday, you might feel excited days in advance. You'd prepare yourself. You might groom, choose a nice outfit, or wear a favorite fragrance. You wanted the evening to go well. In the same way, planning time together can actually create anticipation and excitement. And when you set aside that time, it leads directly to the next tip: mindfulness. Not long ago, I made a video about how mindfulness can improve intimacy, and it truly can. Being mindful means staying fully present in the moment during intimacy, rather than letting your mind wander to other responsibilities. Of course, random thoughts may still appear. You might suddenly remember something like, "Did I forget to water the plants?" When that happens, simply let the thought come and go, and gently bring your attention back to the moment. Focus on what you're experiencing, how your partner is holding you, how their touch feels, their scent, or the comfort of being close in their arms. When you concentrate on these sensations, it often leads to a better overall experience, greater pleasure, and stronger emotional connection. Finally, we come to number 10, something that isn't talked about very often when discussing intimacy: exercise. We already know that exercise is beneficial for overall health. It helps reduce stress, boosts mood, and can support a healthy weight. But research has also shown that physical activity is linked to improved sexual arousal. Activities such as walking, swimming, yoga, or strength training can all play a role. In fact, one study found that people who engaged in more intense exercise reported experiencing stronger orgasms later on. So exercise can actually help prepare your body for intimacy. You might try something simple, perhaps relax as I mentioned earlier, or spend 20 minutes at the gym. Afterward, come home, take a shower together, and see where the evening takes you. Alright, I hope you enjoyed this video. As always, remember to take care of yourself, because you're worth it.